Good morning, everybody. Happy Thursday. This is Lori Wilson with you on this July 20th already. Where is the summer going? Thank you for being with us on Community Voice. We have in the hot seat today, it's not really a hot seat, Sheila, at all, I promise. Sheila Butler, local health insurance agent, Sheila J. Butler and Company, in business for 20 years already. I think I remember your first billboard going up.
That was about 20 years ago.
Wow, congratulations.
Same spot.
Same spot. Yeah, it is.
You always had it, yes.
Hey, when it works, you stick with it.
That's right.
So we're going to talk, thank goodness you're here today to talk about health insurance, the Health Care Act, all of the acronyms that have been flying around ever since God knows when. Before the show, you and I started a side conversation about HIPAA, which that's an acronym that we encounter all the time when we go to the doctor. How did we get here? What's going on? That's what we're going to do today. Sheila's going to enlighten us as to the state of all things in health insurance.
So a backwards journey,
Okay.
20 years ago, or some 20 years ago, 2 decades, we've had a shot at trying to resolve healthcare reform, failing, but learning from our mistakes, we hope. That's what we all hope for. So HIPAA, the very first wave of healthcare reform, resolve.
What does that even mean?
The acronym stands for Health Insurance Portability and Privacy Act.
Okay.
So it's often misspelt. Most people spell it HIPAA.
Well, that's just wrong.
Yeah. So that law consisted of 350 pages of law, and I was very interested in learning all 352 pages because I was brand new to the industry regarding health insurance and deductibles and co-insurance and co-pays and pre-existing conditions and guarantee issue. And this wave of law changed everything about the way health insurance was underwritten. This particular law gave what most people don't understand, the ability for no pre-existing conditions. And as long as you had insurance, you could port it. You could take it. It was portable, which is part of that portability.
The first of 2 Ps in HIPAA.
Right.
Okay, so what you're saying is back in 1996, if one were already insured,
Yes.
and he or she wanted to move their policy to another state or just another carrier?
Any state, any carrier, within 30 days, they could get no pre-existing. They could get all of their health conditions covered. So this is there's a misconception of that because everyone thinks that came in the ACA, and it was before the ACA. The difference in those two is all insurance carriers, whether it be a group policy or a private policy, dropped the underwriting part, so it's guarantee issue, and no pre-existings, conditions, whether you had prior coverage or not. So that's the difference between the two levels of healthcare reform.
Okay. First, I just want to interject that we are on Facebook Live. So that's News Talk 1330 on Facebook. So if you have any questions, type away, and we'll see if we can get to them if your host can figure out how to find them. Okay, so that's that. I don't even know where to begin, Sheila. It's been all healthcare all the time in our everyday life. I mean, at least since Obama was elected, if not before. Now I'm hearing talk of single payer healthcare. The ACA, the affordable, there's a euphemism for you. The Affordable Care Act has deprived us of, how many carriers did we have before, and now how many do we have after?
It had dwindled from the 1996 implementation of law. When I started in business, there were over 20 insurance carriers that I could accommodate a quote from in the marketplace. From 1996 to 2014, we lost about 14 of those carriers, and there are about 6 in the marketplace right now, below the markets of 50 employees and in the private market. So in 2016, most of the carriers pulled out of what we call the private market, the open market, where you go out and buy an insurance policy yourself, and there's only 2 left in the state of Georgia now.
Some states have 0, right?
Well, there's some discussion that many states, Anthem is the only insurance carrier, and they will pull out in 2018. So we do have a big crisis. Now, in the employer group market, which we do focus on at our agency, there are still 6 insurance carriers that offer insurance quotes, but they cannot health risk underwrite those products, so they do struggle to stay ahead of health risks that enter into their programs through guarantee issue.
Can you give us an example? Because these are the kinds of phrases that we hear all the time on the radio and the TV, and really they make my brain glaze over, and I might not be the only one.
Everyone shuts their brain off when you say insurance or
Yeah,
health insurance.
or whatever it
Well,
is
what
you
it
just
means
said.
is, if let's just assume that I had breast cancer and I was not working, became healthy enough to go back to work, and went to work for an employer who offered group health insurance, I would not have any health questions asked, and I would be given the exact same rate as the person sitting next to me. So it's just a cookie cutter model. That's called community rating, and that's 2 employees to 50 employees. Insurance is not required by the employer. Above 50, it is currently required by the employer to offer. Okay, there is that guarantee issue market below 50, which they refer to it as community rating. So it's the result of that is rates have increased by about 30% over prior years.
That's not exactly every household's going to save $2,400 a year. I'm hearing, and this is not on our cheat sheet here, but I'm hearing that the Affordable Health Care Act actually was designed to fail in order to trigger, in order to create a crisis that would therefore enable the government to just say, okay, forget it, we're doing single payer. What do you think about that?
Well, you used one word that I find intriguing. You said here.
Yeah, I hear.
It's happening right before your eyes.
Okay.
So it's whether it was designed to or not, that has been the outcome, which I believe is why President Trump is very frustrated, because replace and repeal, we know that it has to be a better answer. And if you read the news headlines today, Trump has ordered, do not leave without a better answer. And for 10 years, going to Washington 3 times, emailing, doing these type of shows, not one politician that I've spoken to has taken this seriously, but there is a better answer.
But why? Now we're getting way out of your bailiwick, I know, but maybe this is just an exclamation. The need is there. Everybody wants to see some kind of order in our healthcare lives, insurance lives. What is going on in Washington?
So let's do this.
Okay.
We can talk about what's not going on and they're not solving the problem.
Okay,
That's
good.
real easy, simply put. But what can we do?
Okay.
My plan, I gave it a name about 6 years ago. It's Hope for Healthcare. And it would be possible because all of these things that I will talk about are already in place today. So instead of a decade, it would only take about 10 days to implement, and it would solve the national health care. Now, I would not do this alone. Obviously, insurance carriers would need to be involved because it is not it's private, not run by the government.
So, okay, Hope for Healthcare, what would this look like? Is it possible? Sheila Butler's proposal for curing what ails us in the health insurance market. We are going to take our first break and hear from Tanner Health System. When we get back, we'll dive into this idea, this proposal, Hope for Healthcare. If you have any questions for Sheila, now's the time to hop on to Facebook, News Talk 1330 WLBB. Ask a question, say hi, and we'll be back in 60 seconds. Stay with us.
Take a walk toward healthy. Tanner Health System wants you to know that taking a brisk 30-minute walk 5 times a week is all it takes for most people to keep fit. Not only that, Going for 30 can lower your blood pressure, cholesterol, and reduce your risk for heart disease and strokes. You experience these benefits even if you divide your time into 2 or 3 segments of 10 to 15 minutes a day. Even if you've been sedentary for years, you can start now. Going for 30 5 times a week has real health benefits. Don't think you can make it for 30 minutes? That's okay. You can work your way up as you get stronger.
Let your mouse do the walking online at www.gethealthylivewell.org. Tanner's go-to online destination for health tips, fitness tracking, healthy recipes, and more. Get inspired to get your healthy on at gethealthylivewell.org.
Let's jump right back into our conversation today. Thank you for joining us on Community Voice, everybody. We have Sheila Butler of Sheila J. Butler and Company Health Insurance. 20 years in the business in our community. Welcome again. We're talking about your proposal, Hope for Healthcare. And remind me after you talk about Hope for Healthcare a little bit. We have a couple of questions from Facebook Live, but I didn't want to break your stride. Tell us more about what this would look like, and is it even possible, this idea of yours?
Kaiser CFO said it best. Sometimes you cannot repair something until it is fully broken.
Lovely.
So maybe I haven't been heard in a decade. Going to Washington, speaking with numerous politicians that I could name, and you know their names, but not taken seriously. It is broken. So what Hope for Healthcare offers is taking out all of the good things that we needed in health insurance that Obama did put in place. So I applaud him for trying.
Give us some examples.
Here they are. Guarantee issue. You should be able to get insurance, but you should need to have it. It shouldn't be a choice once a year that you can drop out of. No pre-existing conditions. Needs to stay. It's been there since 1996 for those who continue to keep it. And it needs to be income-based, okay? So this is a hybrid of 2 parties. And that's, you meet in the middle. That's what you do. You meet in the middle, and that's what this plan does. In addition to what's already there in the current law, we have the tax-paying system. And I'm not a politician, so I'm all right saying that it's going to be a tax, friends. It's got to cost something, right? But your cost share with your employer, if you're an employee, and if you are a private payer buying ridiculous premiums for terrible benefits, unless you're on the subsidy, and then all you have is a poor network, those are your choices. That's what's going on right now. So this solution actually improves the current situation. So the way it works is the minimal tax or cost share would be a tax that is generated, a reinsurance. It's a reinsurance program. The tax would cover the catastrophic dollars. Reinsurance carriers, you see that fee maybe $40 per month.
What's reinsurance?
A claim that hits a catastrophic dollar amount, the premium that you pay for that part of your coverage, let's just call it $40,000 in claims, $40 a month for simple math. Okay. 300 million Americans monthly collected through normal tax chains now is about $30 billion a month. And if you take the 80-20 rule, only 20% of Americans utilize that pool of need.
But under your plan, we would all just pay $40 a month.
Well, I say based on your income. So that was just for simple math.
So that's somebody making $30,000.
That's an insurance carrier. An insurance carrier could be brought into this by President Trump to say, make this actuarially work for this nation. Why are we not pulling them in? They know how to do it, right?
Why aren't we pulling them in?
Good question.
Okay, sorry.
Very good question. I mean, these are all of the things that we all want to know, but politicians are going down the wrong road.
Okay, I don't want you to forget where you were just now, but I think this ties into a question that we have from Facebook Live, and that is there anywhere we can get information that is free of political slant, one way or the other? How can we educate ourselves without having to depend on news organizations or politicians, corrupt or otherwise, saying, just trying to get us all riled up? We just want the facts.
Well, it's all a matter of opinion. opinion. So until there's a better solution, there's nothing good to listen to right now. You know,
we're just in the dark. We're groping around.
Well, you're
dark.
in the dark right now.
Uh-huh.
I mean, with a little bit of spotlight here and there. There's nothing.
Are you in the dark?
No.
Okay.
But I'm a professional, and I read insurance carrier bulletins that keep up with what's really going on in the law and what will work and what will not work. So insurance carriers and insurance professionals are probably your best place, but 90% of the insurance professionals out there will say, oh, I can't do anything about it. It's that Obamacare, which is a terrible statement. We should have a better answer. We are the voice of any community, and we do. We are boots on the ground. We know what's going on. And we should have an answer.
Is it a matter of you guys? I mean, can't you guys have a big conference or something? I mean, if you guys all know what's going on and how to fix it, what's stopping you from joining forces and storming Washington and saying, hey?
Well, I don't know that everybody has this idea, but
okay. Okay.
I do, and I have tried.
Okay,
I've been to Washington twice.
We are going, okay, so you're going through your idea that's called Hope for Healthcare, and we talked about, continue to outline your the line items in this idea.
So the tax proposes that the claim would be identified in high volume. So that's the catastrophic claim. So think of your own personal use. When is the last time you've had a $40,000 claim? Well, the tax goes into this pool, this $30 billion pool that the government does not run. They collect it, and it goes to insurance carriers you can choose from. So you would also have a platform to choose from for your reinsurance tax. You would go online. The online systems are already there through Obamacare. The low-lying claims below $40,000 would stop at a cancer. An actuary and an underwriter would know how to price that, so a guarantee issue product would be real easy. You would open this market back up, and insurance costs would come down by about a third. So I'll give you just a little example of what that would look like. Nobody likes the word tax, and politicians stop you, which is why I've not been heard. Mm-hmm. They can't say the word tax. They don't really know how to say it officially.
Can you call it, Jerome?
Let's call it Sally.
Yeah.
Okay. So an example in my mind from my experience, you take a salary of someone who's making $30,000 a year, and let's just say that you put a percentage to that income level, and that becomes actuarially the number that makes this program work for reinsurance funding.
Okay.
We all are together in this, and we would all pay it. So not one person would be left out unless you were unemployed. Well, that, there are ways and means to make that happen as well. No one should suffer, but no one should go without it. You should not have the choice. I agree with that. Mm-hmm. Totally. You can't just drop out after your knee surgery. That's what the Obamacare plan does right now. It allows you to drop out and come back in January.
When you have a gallbladder.
HIV or a gallbladder to be removed.
Yeah.
So, the system is going to be broken because people are only going to buy it when they need it.
So I'm doing the math here. Under your scenario, a male age 35 salary of $30,000 would end up with a monthly cost.
I used my $40 just for an example of what most reinsurance fees are in self-insured contracts.
I mean, that's in the 100s of percent. That's like 0.0046% of a yearly. Am I doing that math right? It's altogether possible that I'm not, but so monthly cost.
Let's just say that the minimum number would be $40 for anyone.
Yeah.
Okay, but the more you make, the more you pay. Let's just say that maybe that is the math. I'm not an actuary,
right,
not an underwriter, but I have studied self-insured claims to the point where I see the consistencies of only 20% of these groups with catastrophic claims above a certain dollar amount. So this is not something I just came up with.
No, you've been at it for a long, long time.
Right.
Okay. We have to take our second break already. When we get back, let's just talk about what your take on what we're seeing unfold before our very eyes in Washington today. Everything changed yesterday. Everything changed the day before. Who knows what tomorrow holds? We're going to find out what Sheila Butler thinks in 1 minute. So stay with us, everybody.
Need help finding something healthy to eat? Tanner Health System has an app for that. Menuit helps you find healthy food options on the go. The smartphone app is powered by Tanner's Health experts, who teamed up with restaurants across West Georgia to make it easier for you to choose healthy food and eat better. Minuit acts like your personal nutrition assistant, showing you the healthiest items on the menu. So when you're not sure what's good to eat, Minuit. You can even use the app to look up recipes and plan healthy meals at home, and modify your options based on nutritional preferences, such as a low-sodium or vegetarian diet. Minuit and Tanner Health System, making it easier to eat healthy and live well. A healthier lifestyle is only a fingertip away. Minuit is free to download on your Apple or Android smartphone. You can download it today by searching Minuit in the App Store or on Google Play. Learn more about Minuit at gethealthylivewell.org.
And we're going to jump right back in. Good morning. Thank you for being with us on Community Voice. This is Lori Wilson, still here with Sheila Butler of Sheila J. Butler and Company. Congratulations on your 20th year.
Thank you.
Sheila. Okay, during the break, full disclosure, I asked Sheila, I exclaimed in my agony, why are politicians on Capitol Hill seemingly committed to blurring the issue or sweeping it under or kicking the can down the road, whatever, rather than just getting down to brass tacks and finishing this and getting it done, perhaps in the way that Sheila outlined in our last segment. And your response was?
Lack of knowledge.
They don't know.
They do not know the answer. Currently, the Trump administration, and obviously I don't have to name the names, and find no fault in what they do not know. You don't know what you do not know.
Yeah, but you should at least know you don't know.
But they're shooting a BB gun at a gorilla. I mean, they're putting a Band-Aid on a bullet hole, and they don't know what to do. They are looking for a better, but who invented the paperclip? Who invented the Post-it note? How easy were those two things to manufacture?
Are you saying that it should be that easy?
I'm just saying it should be that easy, but they haven't found it yet.
So do you think that just repealing it, just get rid of it?
With this idea, yes.
So you don't have to repeal and replace, because the idea of
we
politicians...
can't go back to what was already broken. In 1996, it was in horrible mess anyway. So all of the things that have been done, I believe, were the pathway or the segue into the better solution, but everyone's so exhausted. People hate insurance so much. I mean, I probably know more about health insurance law than most lawyers.
Yeah, I bet you do.
Because I study it every day, but that doesn't mean that I am a lawyer. It just means that I study it every day. Politicians do not study.
Well,
even the doctors that have given up their jobs to go to Washington to solve the problem are not insurance brokers.
Do they have anybody like you that they're talking to?
I don't know.
Huh.
But I have gone to Washington twice.
So what you're saying is repeal the whole mess. And then
I would keep some of these things. Some of these things are necessary, and I believe that the public is counting on some of the things that were there.
The guarantee issue.
No pre-existing conditions.
You
could do a guarantee issue as long as you had a reinsurance fund.
When you say no pre-existing conditions, you're saying no refusal for somebody who has had pre-existing conditions?
That's correct.
Okay.
But everyone's forced to pay the tax.
You said the T word.
Yeah, I did. I said the T word.
Well, that's all right. We pay taxes for other things, too. I mean, if they're low,
you're paying 7 levels of tax right now.
I want to talk about
it. Yeah, you are. They're hidden in those 20,000-page documents.
So what did you think about that lunch that President Trump had with his legislators?
Well, from what I read this morning, they're still there trying to figure it out. And he has pretty much told them they can't leave until they come up with a better idea. So, gentlemen, I'd say to you, if you'd like to go home anytime soon, give me a call.
Yeah, no kidding. I was going to say, Sheila J. Butler and Company will be happy to help you, and we'd be very, very grateful. What do you think is going to happen? Oh, boy. Silence. Radio silence.
Yeah. I mean, we cannot tolerate more carriers exiting the market.
Well, who do we have now? Whom do we have?
Blue Cross Blue Shield, and known as Anthem also, and Kaiser. but we will not know if they're staying in the marketplace until October.
Are these companies just dissolving, or are they just changing their product?
Again, there's two different product lines, two different buyers. One is the person who has to go out and buy it on their own because their employer doesn't offer insurance. In the group market, there are more options, but even in the group market, last fall, the government said no to 2 carriers trying to merge. So that would have left us with about 3 in the marketplace. So, I mean, when there's only one choice, there's only one choice. The question is, who will that be? Will it be the government, or will it be one strong carrier? Well, that's a monopoly.
Right.
So that can't happen. This is why they're desperate in Washington to find something, anything, that is better than what we have. But that works.
Right, but that works. Do you agree that health care or health insurance should be a basic human right in America?
Well, that guarantee issue and no pre-existing conditions is a human right. What do you mean exactly by human right?
Well, you know, like
that you should be able to buy it.
That we are born with certain inalienable rights, life, liberty, and the pursuit of happiness. So would you say that health insurance would be one of those rights under the line item life?
I would, as long as you're responsible, like in anything else that you do. Mm-hmm. If you only feel like you need health insurance when you need it, then the system will never work. It will never work that way. Mm-hmm. I mean, when you say right, who's right? Right to purchase? Right to purchase anytime for any price?
Well, I mean, as opposed to Bernie Sanders saying we should have free health care all the time. Isn't that adorable?
I'm sure all physicians just love the fact they're going to be told what to do. They're going to be so passionate about their jobs, aren't they?
They're going to do their 12 years in college.
Oh, yeah. We're going to, yeah.
Yeah. Okay, we have a little fewer than 3 minutes. I'm going to give them to you because I keep interrupting you with all these questions.
Fine.
What's your prognostication? What do you think is going to happen?
I have no words for that. I really don't.
You're disgusted, I think.
I'm very frustrated. Mm-hmm. I'm going to continue. I'll tell you what we're doing. What we're doing is I am reading. I pay a fee to have the most up-to-date law changes fed to me, so I'm knowledgeable. Going to continue to be knowledgeable, and I'm going to continue to consult my clients on everything that I know by staying in very close partnership with all the insurance carriers that we do business with. So I'm going to have answers.
I just had a question for you. I just had an idea. How about producing a video on YouTube? I mean, I hope our listeners are actually watching on Facebook Live, because I can see the passion and the anger actually in your eyes. And I think you would, I mean, maybe you could make us a video or something and explain it to us. Who knows? We need to all of this demystified for us. It's just an idea.
That's actually in the works.
Is it really?
Yes.
Okay.
And the reason it is because if politicians don't listen to one simple idea, or what could be one simple idea, then maybe that they'll listen to the population to say, I like that idea.
Right.
And if there were a YouTube video, I bet you there would be 100,000 views in a day.
When can we look forward to that, if I may be so bold?
I hope to have it done within a month.
Will you come back and talk to us about it?
Yeah.
We'll bust it out. We'll have a premiere somehow on a radio. I don't know. Anyway, okay. Gosh, I have 10 hours worth of questions, but we have 30 seconds left. Thank you so much for being here. We heard you and we saw you on Facebook Live. Promise to come back, so we'll talk about that as well. And everybody, just stay informed and ask questions, and let's all write to our Congress people and our senators today. You should do that. I think that's a good idea, right?
I think tweeting is what they're doing these days.
Okay, tweet
Hope for Healthcare.
Hope for Healthcare, everybody, and have a wonderful day. Sheila Butler, 20 years in business. Bye-bye, everyone.